if you would prefer, just so that we can share this with anybody who's not made it today, and so that you can watch back if needed. And I will share all the slides from today as well afterwards, so don't feel like you need to make too many notes. So just for the contents of today, we're going to go through in 4 rough sections, starting with a bit of an introduction to what VCSE Voices is, just the basics. Sorry if you've already heard it, but I think it's a good place to start. And then we're going to move on and look in more detail about what it's all about. So the role of advocate and the particular opportunities that we have at the moment, the boards that we are going to start recruiting people to. And we're going to have a little look at the commitment, the time commitment, the support on offer, some of those communication mechanisms, and all the support really that's on offer around this project. And then we're going to move on to look more closely at the application process and how to apply, what that looks like, and the timeframes. And then we're just going to finish with a little bit of initial feedback from our community consultation and just sort of the plan now for the next few months. So there'll be lots of opportunities at the end to ask questions, but if you do have any really pressing questions, please do put them in the chat and we'll monitor them, and hopefully we'll get round to answering everybody's questions. So we'll start with the basics. So VCSE Voices is so it's a new project, and it's all about increasing opportunities for more leadership, for more representation, and for people like you to have a voice at a more strategic level across the district. And so to do this, we're recruiting senior leaders like yourselves to attend strategic decision-making meetings. And it's probably worth saying at this point that senior leaders don't need to be chief execs or trustees. You can be volunteers or anybody who's got a good experience of the voluntary sector. So we're recruiting people to attend boards and decision-making boards. So there are loads and loads of boards which are basically meetings which take place across the district to plan and develop services and bring people together to create coordinated services. And they don't exist in silos like this. Of course, there's lots of overlap, but generally we're looking at meetings that take place in the health sector, within planning, adult services, and of course there's lots of boards and meetings that exist and take place to plan and coordinate children's services in the Wakefield district. And there's reams and reams of these decision-making boards that happen. So we're recruiting people to attend some of these boards, and they're going to be called VCSE advocates, and you'll have heard that term bandied around a little bit. And I think it's important at this point to say that we're calling them advocates and not representatives, because it's important to us that the people that kind of fulfill this role aren't just representing themselves or their own organisation or their own experiences, but they are very much advocating for the collective sector and sharing information and experiences and viewpoints of other organisations, so that they can really kind of be the voice of more than just themselves. So that's really where that name comes from. And I think it's important to mention at this early point that, you know, it's all about advocating for the entire sector and not going to meetings just to represent yourself. So you'll be broadcasting the needs and views of the sector, providing that voice, providing some representation where possible, and very much also reporting information back from meetings. So going to the meetings, contributing, but also taking all that knowledge and updates from meetings and sharing that back into the sector. And to do that, we're going to have this VCSE Voices network, which is where the title of all this work comes from. So there'll be lots of different advocates and people like yourselves who will be going to meetings, providing information, providing updates, and kind of advising on how sectors can work together better, and then all the advocates will come together and they will form this network, VCSE Voices, and it's another kind of meeting, if you like, a peer space to share updates from meetings and talk about what's going on, identify kind of themes that are occurring across different meetings, also a space to provide peer support and do some of that collaborative thinking and kind of problem solving, especially bringing sort of action points back from meetings and getting some of that feedback from the wider sector. And also really so that we avoid duplication and we kind of share knowledge. And so the VCSE Voices network will have a chair from the sector. So one of our advocates, most likely, it will rotate. There'll be lots of opportunities for development and training through this, but we will facilitate the network and make it as easy as possible for you to participate. So I've just touched on it briefly, but it's really important, I think, as part of this whole project that there'll be two-way communications, and just to underline that. So you'll be sharing information and experiences from your kind of roles, your voluntary roles, your organisations into meetings, but you'll also be reporting that back into the sector, and I'll go into a bit more detail about how we might do that later on. But the overall aim is that we have this real kind of improved circularity of communication where we've got voluntary organisations as advocates going into board meetings, sharing information and taking that information back to the network, that information being collated and going to wider meetings and members, and we can also support with that and then collate information and give that back to the advocates, and it will go, obviously it won't work exactly like this, but we're aiming for more sharing, more updates, more people being in the know about what's happening at a strategic level to help kind of plan and help I guess inform strategy about what's going on in the voluntary sector, and you know that best, as often you're the ones at the coalface. So that's the kind of the project in a nutshell, and we're going to have a look now in a little bit more detail about what advocate opportunities we have and which boards we are recruiting people onto now. So it's probably worth noting at this stage that we're going to look at advocate opportunities and board membership, but there's loads and loads of boards and meetings that exist, and we've been doing some ongoing mapping to try and understand what meetings happen, where we need voluntary representation to be, and we've got a long list of boards and meetings that happen, and there are lots and lots of opportunities, and the recruitment to these boards is going to be a process, and this is just the first round, if you like, and we're starting with 12 board opportunities, 12 kind of advocate places, which are split across the different services as a starting point to kind of get things moving, to understand how it's going to work a bit more, to get some feedback and very much develop it with those advocates that come into post. But if these opportunities aren't the right ones for you now, or you might want to get involved in the future, there will be other rounds, if you like, and more opportunities. And the ones that we've started with are kind of, we're prioritizing those strategic level ones, the kind of top level boards, if you like, in line with the whole point about, you know, empowering opportunities for leadership. So I'm going to give you a bit of information about each board and the sort of advocate that we want to be recruiting to the board, but you don't need to remember all of this. All of this information is written down on our website, and I'm going to be talking about where to find it a little bit later on. And also it's important, I think, to say that the information I give now is just a summary, it's just a snippet, and all that full information about the remit and purpose of the board can be found in written documents. And there'll be lots of support to really fully understand exactly what the board does. But we're going to have a look at where we're starting. So these are grouped into kind of service areas, but as I said earlier, we do know they don't exist in silos. You know, health is adult services and children's services, but this is just to try and provide a little bit of structure. So I'm going to talk through each board a little bit. So we're going to be recruiting an advocate to the Wakefield District Health and Care Partnership. So this is a fairly top level board bringing together NHS organisations, colleagues from the council, Health Watch, and housing and community sector organisations with a pretty broad remit to improve population health, with a particular focus on prevention and sustainability and equity of healthcare. So it's quite a broad meeting. And so the person who's going to be our voluntary sector advocate needs to really have a kind of a broad and comprehensive knowledge of the wide range of issues which impact people's health and well-being, and factors that also affect health inequalities. They need to be informed and connected to different voluntary organisations who deliver health services in Wakefield, so that they can provide really up-to-date knowledge and feedback from those organisations. And they might also be working or volunteering within an established charity health service, for example, a hospice or a mental health service. But obviously not compulsory. So I think the breadth of knowledge is key here, and ability to identify those themes and kind of work together with lots of different partners. So that's the first one. So the second kind of meeting that happens within health, within the Health and Care Partnership that we're recruiting an advocate for, is the Provider Collaborative. So the clue is in the title here, in that this is a partnership bringing together public providers of health services. So it includes hospital trusts and GP practices, mental health services and community providers. And this one's chaired by a GP, so the focus is on those provisions and working together to agree and deliver plans and services to meet health and care needs, and to very much focus on improving patient outcomes and reducing health inequalities. So to be an advocate on this one, it might be helpful if you're connected to a provider organisation who offer health and social care services, or have got that experience of offering, services to support health and wellbeing within the voluntary sector. And you need to be able to use that knowledge, to work with the rest of the board to improve patient experience and outcomes. And I think it's really important, a really good opportunity here for that kind of collaborative working, about signposting, being informed about what's going on in statutory services and how that can work well with the voluntary service. So that's the second one. Moving on to the third one, which is the People's Panel. Again, the clue's in the title. This is a public assurance group. So the meeting happens and it brings members of the public can attend this and provide kind of feedback about their experience of care. And it's that feedback is the idea then is that it's used to kind of improve services. So the focus here is on the public being an assurance group, using patient involvement and experiences to make changes. And the panel ensures that services respond to and benefit the people that use them, and they have a responsibility for advising about the use of public involvement. So there's good opportunities here, I think, for the advocate to both contribute to providing that feedback, but also to be there to hear feedback and use that in developing services and sharing that again within the network, and to have kind of updates from wider public opinion about what healthcare is needed and all that sort of feedback. So the next one is the Housing, Health and Social Care Partnership. So this one, again, it exists to support the health and wellbeing of people in Wakefield District, but focuses on some of those wider determinants of health, and particularly on the connection between the quality and suitability of housing that people have and their health standards. So they have a kind of a priority focus on ensuring that people have appropriate, affordable housing and have safe and warm places to live. And they cover areas linked to this, such as, reducing fuel poverty, tackling poor property conditions, increasing safety in the home, and supporting people to live safely in their homes for longer as well. So quite broad. All of these are going to be broad, and you can bring various experience, but again, it's that, I think, focus on supporting communities who experience health inequalities, and having a knowledge about, you know, how housing affects health, and some of those wider determinants of health as well, you know, education and employment. So you might have experience working with people experiencing homelessness or in sheltered housing schemes, or providing services to enable independent living, but that's absolutely not an exhaustive list. There's also going to be a health inequalities steering group, but this is a really new one, which is just starting up. So that one, there'll be more information on the website about that one. So the next ones are within children and young people's services. So we're starting with the Children and Young People's Partnership Board, which similarly is a high-level board with wide membership and partnership and participation, but it's responsible really for overseeing and providing direction for children and young people's services across the district. So a pretty broad remit, and it brings together lots of different partners from the local area to work together on making decisions, providing strategic leadership and delivering outcomes, which ultimately with the overall aim of improving the well-being of children in the district. So pretty broad, and the advocate needs to have a good broad understanding of multi-agency children and young people services. So, you know, connections to statutory services, schools, but also very much a knowledge of voluntary services and how it all links up to support young people and how it could maybe better work. You need to have a nuanced understanding of the context that services operate in. So, you know, understanding of the wider issues going on at the moment, which are affecting young people, and how this, you know, informs how services need to be shaped. And I think it's really important as well that this advocate needs to contribute to ensuring that the voices of children and young people are really heard and acted upon. So having connection to, you know, young people's services and knowing that about the voices, opinions, wants, needs of young people is really important. So you might have experience delivering youth-led services or services which are designed by young people, just so that you've got that experience of really keeping a young person's voice central to all of the planning and decision making. And they do lots of other things, but that's just a kind of overview. So the next one is the SEND Strategic Partnership, so the Special Educational Needs and Disabilities Partnership. And, you know, the title says it all. This one works to improve services for children and young people with special educational needs and disabilities, and also their families and carers. So they enable and plan reform to services and looking at some of the strategic challenges. And again, they aim to put children and young people's voices and, you know, the voices of their families and carers at the centre of all those decision-making processes. So again, the advocate needs to be really kind of closely connected to and informed by those views. So working with children and young people who have special educational needs and disabilities, supporting their families, providing services to them, or, you know, past experience of that and connection to voluntary services that do that. You need to be able to advocate for those people and the services that they're receiving in the voluntary setting. And I think it's probably helpful within kind of this one to have potentially professional knowledge of working in a SEND environment or lived experience, which of course goes for all of these boards, all really helpful. But you do need to, you know, be able to provide insight and knowledge about how the work of the whole VCSE sector can support the SEND strategy and provision. The next one is the Early Years Strategic Partnership. It oversees the development and strategy for early years services. The overall aim is ensuring that every child in our district has the best start in life, and that covers from pregnancy through to the first years of primary. Some of the key areas they look at and at the moment include breastfeeding support, home learning environments, and infant-parent relationships. So the advocate ideally will have good knowledge of those sorts of areas, will have experience working within early years settings in a voluntary practice, and have the ability to kind of develop and challenge. Sorry, I'm just looking at the chat. They'll have the ability to develop and challenge policy in line with that aim to ensure every child has the best start in life. So professional experience maybe in an early years settings would be helpful, or just voluntary experience working within early years settings. And then the final one at the moment for the children is the Family and Youth Hub Development Group. So this one provides leadership to oversee a kind of a consistent offer from family and youth hubs in the district. So the overall aim is, again, improving outcomes for children, young people and their families. You need to be in a position to actively listen and respond to the voice of children, young people and their families, and develop services to kind of respond to these needs and priorities. So again, that connection to children and young people, really important. Connection to family and youth hubs, really important again, and just a broad and current knowledge of service delivery of the multiple youth and family hubs across the district, with, again, the ability to look at identifying themes and broadcasting information where important. So these are really these are summaries, but just to give you an idea of the boards that we're looking at. So I appreciate there's lots of information here. This is the last one. So the ones in adults services, we've just got 3 to start with. The first being the Adult Safeguarding Board. So in a nutshell, this one exists to stop abuse and neglect, and they're responsible for coordinating the kind of district-wide approach to safeguarding. They oversee safeguarding policy, accountability, and they also look at safeguarding data to develop strategy and knowledge to improve the lives of adults in the district. So to be an advocate here, you need to have good experience working in a role with safeguarding responsibilities, having probably worked in a voluntary setting, providing services to adults who may be at risk of abuse or neglect or have care and support needs. So some kind of hands-on experience working with safeguarding. It will help to have a good knowledge of safeguarding legislation. It doesn't need to be, really in-depth legal stuff, but knowledge of policies and procedures and practical experience of dealing with safeguarding concerns. And I think also a local knowledge of some of the safeguarding issues that exist in different kind of places. So that's that one. And then the Learning Disability and Autism Partnership. This one is about improving the health and well-being of adults and young people who are 16 to 17 with learning disabilities and or autism. The board's responsible for improving the social care services that people with learning disabilities and their families and carers receive. The board influences and oversees decision-making around those kind of services and aims to ensure that health and social care services are planned and developed so that they meet the needs of adults with learning disabilities and or autism. So to be an advocate at this board, you need to have a good understanding of the needs of adults and young people aged 16 to 17 with learning disabilities and or autism, and that will likely come through experience in a voluntary setting, volunteering or working with these people. You need to have up-to-date working knowledge of the relevant services offered. So services, it doesn't have to be exclusively a service working with adults with learning disabilities and or autism, but knowledge of voluntary services that do support these people. You might be a service user, a professional practitioner or volunteer. I think lived experience, again, really important on this one, and an awareness of how learning disability and autism support services connect at key transition points to support young people. Moving from young people's services into adult services is really important here as well. And then the final one, sorry for all the information, is the Safer Together Partnership. So this one exists to create safe and confident communities, and they have a priority focus on crime prevention and then supporting people who are victims of crime. The partnership enables closer working between the member organisations, and it exists to develop a more strategic approach to building safer communities. And it has some of the following priorities. So they look at violent crime, they look at domestic abuse, rape and other sexual offences, preventing terrorism, hate crime and antisocial behaviour. So it's a pretty broad remit on crime prevention. So ideally, an advocate will have experience of supporting community safety initiatives within the voluntary sector, and will have experience of engaging communities in preventative solutions, and just be connected to those organisations that are in the community that are working to support people who both commit crime and who are victims of crime, with the overall aim of building safer communities. So I appreciate there's lots of information there, and you might not have retained all of that, but all of this information is on our website, and you can kind of look through it in your own time and kind of digest all of that at your own pace. So this takes us on to how we're doing it. So each one of these boards that we've just looked at has a role profile. It's in a standard format, hopefully, so that it's easy to follow and easy to navigate. We're going to have a quick look through an example on screen, and I'll show you where to find them on the website. And you can always request more information if it's needed. So I'm just going to share this now. So this is an example of one of our role profiles. This is the Health and Care Partnership, and they all look very similar for the boards that we've just looked through. So it gives you at the top an overview of what the board is all about, the purpose of the board, the remit of the board, its responsibilities, and it gives you an overview of the role of the advocate. And here it has a little bit more information about what sort of experience or knowledge you might bring to the board. It gives you some information about how often the board meets, so you have an idea of the time commitment that's involved, and sort of the kind of expectations around how many meetings you need to go to. You can also request the terms of reference for the board if you think that would be helpful to really see the nitty-gritty of the board. That's available as well. A bit of information on who we are looking for, not dissimilar to sort of a job role. Here are some of the things that you might have. So some of the duties and responsibilities that will be involved, and then some of the skills and experience that you might have. And each one of the opportunities, each one of the advocate roles has one of these. So you can have a look through this at your own time. And then there's just a little bit of information at the end about the support available, the backfill, which we're going to talk a little bit about next, and how to apply. So hopefully those will be useful documents for you. So I'll just show you where to find those. So for those 12 roles, you can go onto our website. So this is the Nova website. Under this tab, Our Work, there's VCSE Voices. And under here is all the information that we've been going through. And if you scroll down, there's the list of all the different opportunities that we've been through in a very whistle-stop tour way just now. And they're all linked. So you can click on them and it will open up the role page for you. And that will take you, so this is where if you click on a link, let me just do it now, it will open a new tab and it will take you to the specific opportunity, and you can download that role description there. We'll send all of this information and instructions in the email follow-up, but just worth showing you on screen so you know where they all are. So you can navigate to it through the VCSE Voices pages, or you can find them all listed under our jobs page. They're all here titled VCSE Advocate. But don't worry, we can help at any step of the way if needed. So let me just go back to the presentation. So they're the roles that we're looking at. And so we're just going to talk now a little bit more about, I guess, what the role of advocate is. So we're all of those opportunities are open now, and we really hope that you'll be interested in applying. We hope that you agree it's an exciting opportunity with lots of kind of chance for development and networking and building relationships with colleagues within the council, within the NHS, to make a difference really ultimately to the communities that you work with. The role is very much for everyone, and there's lots of support on offer to help you prepare and training if that's needed. Of course, we appreciate that not everybody will need that, but it is there to enable accessibility. And again, just to mention at this point that the role really is to advocate for the whole sector and not just represent your own organisation. So there's lots of overlap within roles, lots of advocacy work, lots of influencing, attending meetings, but each of those roles has their own remit and own kind of experience and skills that will be needed. So the role of advocate, we are hoping that people will commit, and there is a bit of commitment required. So advocates will need to kind of commit to attending meetings, and the information about how often those meetings is on those role profiles. Of course, we also understand that sometimes you're not going to be able to make them all, and that's fine. But the general gist is that we hope people will commit to attending meetings and preparing for them, and investing time as well to share information from those meetings back to the whole sector, investing time to come to the network to kind of share information and ideas, and participate in peer support. But it's important to emphasize that we don't want this to be, you know, onerous or unduly time consuming, and we want people to be able to participate as much as they can, and we'll support to enable that to happen. And I think in recognition of the commitment that we're asking, it kind of is the link to backfill and reimbursement, if you like. So payment backfill will be paid to organisations the advocates organisation for their time dedicated to attending these meetings, and it's a rate of £21.50 an hour, which will be paid for attending meetings and preparing for meetings, and that includes kind of expenses as well, but there will be leeway there for people, you know, with additional kind of maybe disabilities, travel expenses, there will be flexibility there. And it's £21.50. This has been kind of designed in consultation with peers in Leeds and Bradford as well, who have been doing this work, and that's kind of the agreed going rate, but that it will, you know, it will continue, we will continue to look at that. At the moment, the proposal is that advocates will serve on a board or be a member on a board for 2 years. And this is just to really give an opportunity to be embedded in that board, to kind of know the other board members, to have a good opportunity to participate and influence. And then there'll be ways in which we plan for succession and deputising, which will probably be through the VCSE Voices network. So there'll be development so that people can step into opportunities as people step out. But we say 2 years, but obviously we understand that some people might need to step out earlier than that, but that's what we're working to. We've also developed an advocate handbook, which will be shared around, which, you know, just is a kind of cohesive document about the roles and expectations, the reimbursement, all that sort of information, so that you have, you know, clear communication about what this is all about and what's expected. And of course, we're going to be offering lots of support. So the support will look like an induction package, which will provide a basic outline of the role and the board. It will cover roles and responsibilities linked to specific boards, and it will include an introduction to kind of board members, the chair, the facilitator. We've been working closely with the boards that we're recruiting to and their business support teams, who are very much on board with this, and who will also provide support to that advocate coming into the meeting, so that they know who's going to be there and they have all the kind of up-to-date information. That training will also cover some things around expectations and advocate conduct, and some work on that, how to best advocate for the whole sector, and influencing really. So that training around recognizing and understanding the difference between advocating for your own organization and for the collective sector. Will be in the training, there'll be lots of stuff around how to supporting you to communicate information from meetings back to the sector, opportunities for answering and asking questions, and also if there are any additional kind of training needs or any development things we can help with, we'll go through all of that. Nova will be providing secretariat support, so help to kind of distribute agendas, or help to, if there are action points where you need to gather feedback from lots of different members, we can help facilitate that, just to try and ease some of the kind of administrative burden on advocates, and really the support will evolve as required, and we'll take the lead from the people who come into post. So that's just a little bit on the role of advocates. So the communication, in terms of communicating back to the sector, we've had a few ideas kind of put forward, and these are some of them. So we're aiming that we'll do, after advocates have gone to meetings, they'll kind of complete a brief form or do a quick debrief to provide information, and we will collate lots of information, but hopefully digestible bullet points, key stuff, and have this available as reports on the website so everybody can access it. Information will also be shared, importantly in the peer meetings, when there'll be a chance for open discussion and gathering kind of advice and feedback from peers. We've also had the suggestion of a WhatsApp group, not for formal communications, but for kind of quick updates and quick information if needed. You can opt in and opt out, and we'll develop that as people want it, but that's a suggestion that we're looking at. We've also got a VCSE Voices inbox, so people can send us documents or reports or information that they want sharing with the wider sector, and so we've got a central point to collate that. We're looking at maybe having a Teams or Slack channel, or maybe short video updates, but I want to say that we're not going to do all of this. These are just some ideas. We'll try and make it as streamlined and as possible, so you don't have multiple different things to be looking at. But I guess the point is that we've got a few tools to help us share that information from meetings back to everybody, and to make it quick and easy and digestible, and we'll work with whatever works best. So that's a kind of look at the opportunities we've got and what the advocates will be doing. So we'll just move on now to have a look at the application process and the timelines. So how to apply. So we have tried to keep this as simple as possible. We don't want it to be time consuming, and we do want it to be accessible. And it's not a test. It's not like a job application in any way. We don't want people to have to jump through hoops that other members of those boards don't have. But equally, we think it's important that there's a little bit of the process, just so that we've got assurance around selecting those advocates. So as we've already been through, all the opportunities are listed on the website with all the information. We'll send out an email which will have some links to help you find those. Start by having a little, look back through all the roles that are available. There's lots of overlap, and it doesn't need to be the case that you only have expert experience in one area and so you go to that board. I think part of this is being able to kind of see the themes and see the links, and think more creatively about how the whole sector can work in those specific areas as well. It's not just in silos. So have a read of those profiles, think about which opportunities might, interest you, and think about applying. And once you've chosen or think you're interested, all we're asking is that you kind of write a short written statement, half a page of A4 is fine, or you can create a video application if that works for you, just saying, why you'll be a good advocate, why you want to do the job, what skills you'll bring. So create a short application, specify which boards you might be interested in being the advocate for, and email that application to VCSE Voices at nova-wd.org.uk. We'll share this round, don't worry. So just to recap on the application. So we don't want to be prescriptive about what you write, but some guidance might be helpful. So just start with some general information about you and your experience in the sector as a starting point. Maybe as you would with a job role, include information that matches up with the role profile. Talk about your specific experience and skills, and think about the remit and purpose of the board. So, you know, if it is the Safeguarding Adults Board, you probably want to include a little bit of information about your kind of experience with safeguarding practice and dealing with safeguarding. Just so it's a little bit tailored. You know, tell us why you're interested and why you'll be a good advocate, and maybe some of your wider skills, but it doesn't need to be long and it doesn't need to be complicated. We have got a short video on the website which talks about things you might want to include in your application. We'll send out the link to that just to provide a bit of guidance if that's helpful, but it doesn't need to be complicated. So the timeframes they're all on the website now, and so you can apply this afternoon if you want, and they're going to be open for 6 weeks until the 3rd of March. The sooner you apply, the better, just to help us coordinate, but you've got 6 weeks. And then we're looking then to interview or have a process for selection on the 8th of March. So the interview process, we've done that one. The interview process is going to be an informal group discussion. It won't be a one-on-one or anything intense, just a little bit about kind of your skills, your thoughts about the roles of advocates as well, and people on the panel will be people from the sector. So we're doing a bit of work on recruiting those people. And then the idea is that the advocates will then, who come into post, will then be the interview kind of panel for the next round, so that these advocates are very much chosen by you. But it will be an informal and easy process, which kind of focuses more on matching than selection, with some peer voting involved. There'll be opportunities for everybody who wants to be an advocate to take part. So it's not a hard process. So that's how to apply and the general timelines. And we're just going to finish up by having a little bit of a look at some of the consultation we've done and the next step. So we've had a community consultation survey out, which is just asked for people's feedback about the process, and just wanted to share a few of those initial kind of opinions. So in response to the question, is advocate the right name? Does that represent what the role was? We've had some feedback around that. So people have said that perhaps advocate doesn't fully represent the kind of experience level needed, and the kind of doesn't necessarily put them on a level playing field. So maybe a term advisor or leader might be more appropriate, and we're going to do some more community consultation next week and the following week, and potentially adjust depending on those discussions. We've had ambassador, but again, people said that might maybe reflect more that it's just looking at one person's opinion rather than a collective opinion. This was around, we asked people about what sort of support they would want to be able to be an advocate, and there was lots of feedback about wanting to have that background about meetings, knowing who was around the table, understand kind of past decisions, past agendas, what are the priorities for that board. So we've kind of started collating some of those documents to help advocates understand that pre-context to meetings. We've also had feedback that secretariat support and lots of kind of advanced planning will be really helpful. So we've put that in place as much as possible. We asked also about what sort of communication methods would be helpful, and we've had various feedback. So WhatsApp groups being helpful for quick information, and again the idea about full reports being on the Nova website, so we've tried to put that in place as well. But this consultation is ongoing, so if you want to kind of give us some feedback, you can complete the survey, which I think is in the chat now, or you can come to one of our focus groups, which are next week. So there's one on the 26th, which is online, 11 o'clock till 12, or the following week on the 2nd of February, which is in person at our office in the afternoon. And we'll send you a little bit more information about that. So the next steps really are that now this is open, and we really want you to apply and get involved. So we're convening the group discussion interview process, and we're collecting applications. I'm really happy to have more conversations one-on-one or personal conversations if you have detailed questions, and we're going to continue the consultation to kind of develop this. And then we'll do the interviews, get some people in place, and hope to grow this with another round of opportunities, and start up the VCSE Voices network. So that's everything.